Nutrition and diseases. This subtopic will mainly focus on nutrition and diabetes as well as cardiovascular disease. A balanced diet is based on the guidelines of Malaysian Healthy Plate. An unbalanced diet can lead to dietary-related diseases. Based on the Malaysian Healthy Plate, there should be a quarter of our plate filled with protein-based food sources. Another quarter of our plate will be filled up with carbohydrate-based food sources, while half of our plate should be filled up with vegetables and fruits, with a glass of plain water. Diabetes is characterized by increased blood glucose or blood sugar levels due to a lack of insulin, which is a hormone which controls blood glucose levels. This is known as type 1 diabetes mellitus, or it can be due to an inability of the body's tissues to respond properly to insulin hormone, a state called insulin resistance. This is known as type 2 diabetes mellitus. Type 2 diabetes mellitus accounts for about 90% of all diabetes mellitus. In addition, another type of diabetes mellitus, known as gestational diabetes mellitus, which develops during pregnancy. Today, there is no cure for diabetes, but effective treatment exists. Diabetes outcome is closely tied to the management strategies and resources available in the various regions of the world. A well-balanced, healthy eating plan is the cornerstone of good blood sugar control for all people with diabetes. Whether you are being treated with insulin or tablets, you still need to follow a sensible eating plan. Eating healthily not only helps to control blood sugar levels, which will delay the onset of diabetes-related complications, but also helps to maintain body weight and prevent heart disease. The old saying, "You are what you eat," is exactly right. Your blood sugar levels are affected by everything you eat. Hence, wise food choices are the key to a healthy life and prevention of illness. The desired plasma glucose levels to be achieved are less than 6.1 millimole per liter before meals and less than 7.8 millimole per liter 2 hours after meals. Using the plate method is one way to guide on a healthy diabetic meal plan. The plate method, developed from the Swedish plate model, is very useful for diabetic meal planning. It is simple to use and inexpensive. We may use paper plates for this. A portable, inexpensive, easy to understand meal plan that costs the health professionals or patient practically nothing. Malaysian Dietitians Association has published medical nutrition therapy guidelines specifically for individuals with type 2 diabetes, whereby we can see that food groups had been classified into 3 categories: low glycemic index, intermediate glycemic index, and high glycemic index. Individuals with diabetes mellitus are advised to choose food from the low glycemic index category. For examples, apple, apricots, banana, mango, orange. They all belongs to the fruits category under the low glycemic index group. Individuals with diabetes carry a risk of coronary heart disease 2 to 4 times than that of individuals without diabetes. Coronary heart disease accounts for about 65 to 75% of death in patients with type 2 diabetes mellitus. The major risk factors of cardiovascular disease include type 2 diabetes mellitus, overweight and obesity, smoking, as well as physically inactive. Individuals with cardiovascular disease will be advised to eat a diet rich in fruits, vegetables, and whole cereal grains. It will provide potassium and fiber, both clearly linked to reduce chronic disease risk. Other important approaches include stop smoking, minimize stress at home and at work, and at least 30 minutes of physical activity daily. Furthermore, if fat or oil is used, unsaturated is healthiest option. Most polyunsaturated fatty acid should be derived from liquid vegetable oils, such as corn, sunflower, soybean, rice bran, sesame, and deep sea cold water fish. These oils are not recommended for deep fat frying due to their chemical composition and low smoking points. For patients with cardiovascular disease, it is recommended to consume more than 2 servings of fish per week, considering the benefits observed with intake of omega-3 fatty acids. Sources of omega-3 fatty acids include deep sea cold water fish, such as salmon, mackerel, fresh sardine, and tuna. Omega-3 fatty acids also lower plasma triglycerides and prevent aggregation of blood platelets. In other words, it has the anti-thrombotic effect, which refers to effects which are good for heart health. So these are the examples of omega-6 fatty acids: alpha-linoleic acid. Examples include corn oil, sunflower oil, safflower, soya bean, nuts, and seeds. The only nutritionally important monounsaturated fatty acid is oleic acid, which is abundant in olive and canola oil and also in nuts. Most monounsaturated fatty acid should be derived from vegetable sources, including plant oils, canola, olive, peanuts, and nuts. These oils are not recommended for deep fat frying. So with this, I would like to end my presentation for this session. Thank you.